This week on Jacksonville Inside and Out, we're talking with Herb Smith, an HIV counselor in Duval County. Welcome to Jacksonville Inside and Out. Now I understand that you are an HIV counselor. I understand that because I've actually done some volunteer work with you in the past. So tell us a little bit about your background first.
Okay. Hey, Christian, it's good to see you again. I am originally, or have been trained as a nurse, a critical care nurse, and also a nurse educator. I was a bedside nurse for 10 years and an educator for 15 years. And during that time, I was around when HIV first came out in the early 80s, or at least became known here in the United States. And at that time, being a member of the LGBT community, I was very concerned and very interested and started at that time attending seminars. Also at that time, a female nurse that I was working with got married, and the person she married happened to be a hemophiliac and then came out of the closet, and he gave her HIV. So we were a team for a while, going to conferences and becoming interested and educated about HIV. And then when I moved to Jacksonville in 1987, I became interested, and then in 96 I was trained as an HIV counselor and tester and began testing at the church I was attending. And then 1 year later, I became the administrator of the program and have also administered programs in 3 other settings. So okay. I've been doing testing for about going on 19 years.
Okay. Now, since you've been involved in this since the very beginning of the HIV network or epidemic, the very beginning of the stages, there's been a big perception shift in how the country views the LGBT community, especially gay men. We're seeing, now when we look at gay people, we tend to think of monogamous relationships because gay marriage is becoming much more acceptable and is happening more. So we're starting to view gay people as more monogamous than we have in the past. Now, is that something that's actually changed with the gay community, or is that something that's always been a part of the gay community, but the media is always focused on younger people who, gay or straight, tend to be more promiscuous?
Well, I think when you look at HIV and AIDS infection statistics, still the number one group that is getting infected are men who have sex with other men. Now, hopefully in the advent of gay marriage, that may promote more monogamy. It may not, but certainly the hope is that if people can view their relationships as monogamous, they have a better chance of not acquiring HIV.
Right, or even other STDs for that matter.
Exactly.
But you don't think it's a more of a youth-oriented thing where it's, younger people?
Well, when you look at statistics again, yes, youth have increasing HIV/AIDS rates, but so do elderly.
So why do you think the elderly community has been increasing?
Well, I think it is related to the fact that we as a culture tend to think older people don't have sex. And that's just not true. Older people are engaging in sexual activity, but they grew up in a at a time when HIV/AIDS was not even on the horizon. So they weren't as affected, unless, of course, they had family members, which nowadays the majority of people have either family members or friends that have been infected or affected by HIV.
If you go back to, say, the 1960s, in a lot of states it was illegal to even be gay, and people would get thrown into mental institutions and that sort of thing. So I could see where maybe there's the idea of safe sex. As I know, when did condoms even become legal? They were outlawed at one point, weren't they? Or was that just birth control pill?
I don't know whether they were. I know that during World War II, they became much more prominent and became on the scene because of the military engaging in sexual activity during the war.
Okay, so safe sex started to become a thing then, but a much more acceptable thing probably in the 80s?
Certainly with the advent of HIV and AIDS. And of course, the gay community kind of had a backlash to it because they thought, you're taking my rights away. And because with the advent of closing bathhouses.
I see. So it felt kind of singled out, but...
Right.
Okay. Well, we'll be right back with more of Jacksonville Inside and Out. Stay tuned. Welcome back to Jacksonville Inside and Out. I'm here with HIV counselor Herb Smith, and we're talking about HIV in Duval County, which, as I understand, is a huge problem in the South, specifically, in the country in general, but the South seems to have higher numbers and worse outcomes. Why is that?
Well, there's been a lot of ideas of why that might be. Some of them are cultural, in that the LGBT community in the South has been underground, though there's a major resurgence at this time, and in the larger cities, of course. But the South also is made up of a lot of rural areas where churches are dominant, and many church views are opposed to homosexuality and the expression thereof.
Right.
So,
but HIV isn't. I mean, it does affect gay people or gay men specifically more than it affects straight couples or straight people, I guess. But my understanding is that is a little bit on the rise, isn't it? Straight couples coming down with HIV.
Yes. Yeah, HIV has no borders. Anyone engaging in activities that spread sticky body fluids are at risk for HIV transmission.
Now, what are some of the, without getting too graphic, what are some of the riskier behaviors versus some of the less risky behaviors? Like, for example, I would think unprotected anal sex would be the highest risk, whereas maybe oral sex would be a much lower risk.
Yeah, and you're exactly right on both of those count. The sexual activity unprotected is number one risk overall, followed by IV drug use and combinations of both.
Okay, now with protected sex, how effective are condoms really?
Well, use of condoms is the primary intervention that people can do to stop the transmission of HIV.
Right, but how effective?
They are effective when used properly, better than 99% of the time.
Right. So when people hear that statistic, though, I know a lot of people who look at that statistic, 99%, well, that means if I have sex 100 times, that 100th time I will get it, but that's not really how statistics work.
No, it's not at all. But even if you thought that, wouldn't you want to be protected those 99 times anyway?
Right, right.
And the 1%. But the real crux of condom use is using them properly. Because if not used properly, an example of that is I had a client come in the other day, and a very young man, 18, and was having sex or was going to have sex with his girlfriend, had opened the condom, but then they decided not to have sex, so they set it aside.
And what's wrong with
Then
that?
about a week later, he used it, and it busted
Okay.
during that use. And so he was back more afraid of his girlfriend being pregnant.
Now, the most common things that I think people understand is to know the expiration date and to make sure that there's no air in the condom, squeeze the tip to make sure there's no air. But what are some of the other things that people overlook?
Okay, some of the things that people overlook is they may think that, oh, I don't trust her or I don't trust him. I'm going to put on 2 or 3 condoms. That's going to give me triple protection. Or I'm going to make him put on 2 or 3 condoms. But remember, anytime condoms are used, multiple condoms, and they rub against each other, it increases astronomically the chances that they're going to break.
Rubbing 2 pieces of latex together is going to break the latex, right?
Indeed.
Okay.
So if one partner's wearing the condom, then the other partner doesn't have to.
So like if somebody doesn't trust their partner and they say, oh, I'll just double up on condoms, they're really increasing their risk.
Absolutely.
Okay. Now,
some of the other things are using lubricant. Now, lubricant and the type of lubricant is critically important. If you're using a latex condom, then you must not use any lubricant that contains oil or petroleum, such as Vaseline.
Right.
And you see that all the time in
that's because
movies.
the oils break down the latex.
Right, because latex is made from a rubber plant.
Right.
And the plant is susceptible to the oil. So the proper types of lubricant to use are water-based, such as KY jelly, but nowadays there's also silicone-based. Both are equally well. Now, the amount of lubricant one should use really depends on the partners, because some women lubricate a lot naturally, some not so much.
Right.
So the amount is
you're
not
saying that
critical, but there should be some.
So you're saying that this is something that you should discuss with your partner going into a
Absolutely.
sexual encounter.
Well, any sexual activity should be discussed with a partner before engaging.
Okay. And so
Now-
just a quick recap. So expiration date, make sure the condom hasn't been punctured in any way, make sure it's still in an air pocket.
Right. Every condom package has an air bubble.
Right, and make sure that the non-oil based lubricants. Now, we will be right back with more Jacksonville Inside and Out.
Okay.
Stay tuned. Welcome back to Jacksonville Inside and Out. We are here again with Herb Smith, an HIV counselor here in Duval County, and we were just talking about condoms. And before we went to as we were going to the break, Herb was about to bring up, what if you're allergic to latex condoms?
Yes, if you're allergic to latex condoms, then you may want to choose natural condoms, but that's not a good choice.
Well, hold on. Natural condoms. You're talking about the lambskin and the pigskin condoms.
Exactly.
But those have pores in them, so they don't protect you against STDs.
Exactly. So that would be a poor choice. But a lot of people who are allergic think that's a good choice. But the better choice is to go to a plastic condom. So your two condom choices are latex or plastic.
Now, what's the difference between latex and poly? You said plastic. You mean polyurethane is what they're usually
Well,
labeling.
some are made of polyurethane, some are made of polypropylene. There's various plastics that can be used. And essentially, there is no difference. A plastic male condom acts exactly like a latex condom. They stretch, they have a tip, they're pre-lubricated. So they're exactly the same except for price. They're way more expensive. But in Duval County, anyone can get free condoms, even non-latex or plastic condoms, at the health department or through any of the testing sites approved through the health department.
Right. Your site gives out free condoms, and that's on Arlington Expressway?
Yes, I test at the Universalist Unitarian Church of Jacksonville, which is 7504 Arlington Expressway, and I test there 3 times a week, Tuesday, Wednesday, and Thursday, and then also every second and fourth Sunday.
So every second and fourth Sunday you're there, and every Tuesday,
Wednesday,
every
and
Tuesday,
Thursday.
Wednesday, and Thursday.
Correct.
So the middle days of the week you're there.
Exactly.
What times usually?
Okay, on Tuesdays, we test from 2 to 5:30. On Wednesday, we test from 1:30 to 6:30. And then on Thursday, we test 12:30 to 5:30.
Okay.
And then when we are on Sundays, the second and fourth, it's from 2 p.m. to 5 p.m.
Okay. Now we were also talking about risk behaviors, and there's a progression of how things are, how risky things are depending on the sexual contact or the sexual activity. Now,
Right.
it doesn't matter whether it's a straight couple or a gay couple. Unprotected anal sex is number one on that list, right?
Right, when you talk about sexual activity, yes, as far as risk factor.
Okay. So where else are the risks?
Okay, other risks are anytime body fluids, sticky body fluids are shared. Breast milk, sticky fluid. And some people engage.
I'm sure there's a fetish for that. So.
Certainly. Now, when you talk about oral sex is generally a lower risk behavior. But here's where oral sex can become risky. If a person has cuts in their mouth, sores in their mouth, rotten teeth, because there has to be an entry port where HIV can enter the body.
Now, when you say sticky fluids, you're talking about semen or vaginal fluids. You're talking about blood. And,
Those are the big two.
And lesser known, I think, is like the kind of the natural lubricants we have in our joints, right?
Well, other body fluids would be breast milk, synovial fluid, which is the fluid around your joints, and spinal fluid, which is the fluid that surrounds our nerves. But you don't have to remember all these names. Just remember.
Because they're not going to come, we're not likely to come in much contact with those.
Right.
But saliva is not one of those fluids.
Right. It has to be a sticky fluid because the sticky fluid has proteins, and proteins are how HIV is transmitted.
So if you have a friend or relative who has HIV and you're worried about your kid or yourself catching it because they drank out of the same glass or anything like that, that's just not an issue.
Right. HIV has to have a warm, moist place to live. So even if, say for instance, a male with HIV/AIDS cuts himself shaving and drops blood on the countertop, it is not going to transmit. However, if a person cuts an artery and there's a pool of blood, then the possibility exists because that blood's going to stay warm for a certain period of time.
But you still have to fall in that blood and have like an exposed wound.
Right. You have to have an exposure.
You're not going to catch it mopping it up.
Right. But back to oral sex, what do we do going out? We brush our teeth. What happens when we brush our teeth? Sometimes our gums bleed, which could be. So there are times biting your nails.
So mouthwash is better than brushing teeth after oral sex?
Possibly so. The good news is our mouth heals over very quickly. The bad news is there could be punctures that we can't see with the naked eye that could be a portal of entry.
Right. Right. Now, there are couples who manage to, and this goes back to the statistics thing with that 99% and some people thinking that means that eventually they will get it, whether they use a condom or not. But there are couples, and I've met a few of them, who one person is negative and the other person is positive, and it's much like couples I know who one of them has herpes and the other doesn't. They manage to stay together all that time and never actually transmit that virus to each other. Now that's got to be what because they're using condoms, right?
It could be because they're using condoms, or if the HIV positive partner is receiving appropriate treatment and their viral load is non-detectable, which means that they do a blood test and no virus shows up. Now that doesn't mean there's no virus present. It just means that to the sensitivity of the test, it does not show up. Okay. Generally, when a person is non-detectable, they do not transmit HIV.
Well, here's something. Now, you mentioned earlier that what was 82% of people tested, or I'm sorry, of the people tested, there's only so many that actually get treatment.
Oh, okay. Well, I don't think we've actually talked to that, but it's called the treatment cascade. In 2012, the CDC compiled statistics and found out that we do a really great job testing. We get about 82 to 85% of the positives, we get them tested. Unfortunately, it drops to 66% for those that we actually refer to treatment. So, and then of that 66, only 37% starts on or stays in treatment. Right. And of that 37, only 33% get appropriate antiviral medication. And of that 33%, only 25% stay on medication and have non-detectable viral loads.
So the important thing that I take away from that is anybody who is sexually active, anybody who's sexually active at all, should be tested. There are lots of free places to get testing. All of those places will give you free condoms. And it's also important that after you're tested, if you do turn out to be positive, to get the treatment that you need and stay the course. Herb Smith is an HIV counselor. He will get you in touch.
Can I add one more
real quick
to that? Treatment is prevention. That's the new mantra. Treatment is prevention. If you're positive, get treatment. Stay in treatment.
All right. Thank you again for watching Jacksonville Inside and Out. I'm Christian Gore, and this has been Herb Smith. And stay safe.